Welcome, and thank you for joining us today. Imagine you've just come out of lung surgery, hoping to start your road to recovery. But instead of breathing easy, you start to feel out of breath again. Coughing becomes more frequent, and something just doesn't feel right. These could be signs of a bronchopleural fistula, a complication that doesn't happen often but can be serious when it does. Now, let's break this down. A bronchopleural fistula is a condition where an abnormal passage forms between the airways in your lungs and the pleural space, which is the area surrounding your lungs. This condition can cause air to leak into places it shouldn't, leading to difficulties in breathing, chronic cough, and in some cases, even life-threatening situations. It's not something many people know about until they have to face it. What exactly is a bronchopleural fistula? To understand this condition better, let's quickly revisit some basic lung anatomy. Your lungs are lined with two protective layers of membrane, and the space between them is called the pleural cavity. Usually, the lungs and this cavity don't mix. But when a fistula forms, an abnormal connection opens up between the pleural cavity and your bronchial tubes, allowing air to leak into the wrong places. While this doesn't happen often, it can develop after lung surgeries, especially procedures like a lobectomy, where part of your lung is removed, or a pneumonectomy, where an entire lung is taken out. The chances of developing a bronchopleural fistula after a lobectomy are relatively low, about 0.5% to 1%. However, after a pneumonectomy, the risk can rise dramatically, with rates between 4.5% and 20%. While rare, it's something to be aware of if you're undergoing or recovering from lung surgery. What are the symptoms? Sometimes, a bronchopleural fistula doesn't give off obvious signs. People may only discover they have it during a routine imaging test when an air leak is spotted. But when symptoms do show up, they can be alarming. Shortness of breath, breathing may feel labored, as if you're gasping for air even at rest. Coughing, persistent coughing, especially if it worsens over time, could be a red flag. Chest discomfort, pain or a feeling of tightness in the chest might develop, especially if air or fluid builds up. In more severe cases, the condition can lead to life-threatening complications if left untreated. That's why early diagnosis is key. If you've had lung surgery or are recovering from a serious lung infection, these symptoms shouldn't be ignored. Causes: why does it happen? So why does a bronchopleural fistula happen? While it can have different causes, surgery tops the list. Procedures for lung cancer, in particular, can increase the risk. Research shows that 2.2% of people developed a bronchopleural fistula after undergoing lung cancer surgery. Those who had a lobectomy had a lower risk at 1.4%, while a pneumonectomy raised that risk to 14.3%. Infection also plays a major role. Severe lung infections can weaken or damage the lung tissue, making it easier for a fistula to develop. A recent case study even linked bronchopleural fistulas to complications from a COVID-19 infection. Tuberculosis, TB, especially in countries with limited healthcare resources, is another potential cause. This type of infection can slowly erode lung tissue, leading to fistula forming over time. Diagnosing a bronchopleural fistula. How can doctors tell if you have a bronchopleural fistula? Imaging is key. A CT scan can create detailed pictures of your lungs and chest cavity to reveal any air leaks. Doctors might also use a bronchoscopy, where they insert a camera through your airways to locate the fistula and assess its size. Both of these methods help doctors figure out exactly where the fistula is and how severe it is, which is crucial for planning treatment. Treatment: how is a bronchopleural fistula managed? Let's talk about treatment. The approach varies depending on the size of the fistula and how severe your symptoms are. There's no one-size-fits-all solution, but here are the most common treatment options. Chest tube placement: a chest tube may be inserted to drain any air or fluid trapped in the pleural space. This helps relieve pressure and lets the lungs expand properly again. Antibiotics: if infection is part of the problem, doctors will likely prescribe broad-spectrum antibiotics to fight off the bacteria. Surgery: in some cases, surgery is necessary to close the fistula and stop the air from leaking. This could involve open chest surgery or less invasive techniques done through bronchoscopy. The treatment plan depends heavily on the location and size of the fistula, as well as the patient's overall health. Some fistulas may close on their own with conservative treatment, while others require more aggressive intervention. The outlook. What's the long-term prognosis? The sooner a bronchopleural fistula is diagnosed and treated, the better the outlook. But even then, recovery can be a slow process, sometimes requiring extended hospital stays and close monitoring. Unfortunately, the condition has a relatively high mortality rate, ranging from 18% to 67%, depending on the severity of the case. If a bronchopleural fistula becomes life-threatening, it's often because of respiratory distress syndrome, a condition where the lungs can no longer get enough oxygen into the bloodstream. Larger air leaks, infections, and patients needing mechanical ventilation are all factors that increase the risk of death. However, success rates for repairing a bronchopleural fistula vary. When doctors use bronchoscopy to manage the condition, the success rate can range from 30% to 80%, depending on the case. Some people recover fully, while others might experience a recurrence and need further treatment. Recovery may include long-term use of antibiotics, additional chest tube placement, and careful monitoring to ensure the fistula doesn't return. Final thoughts: awareness can save lives. So, what's the key takeaway here? While a bronchopleural fistula is rare, it can happen after lung surgery or severe lung infections. And though the condition can be serious, with early detection and the right treatment, many people can recover. If you've recently undergone lung surgery or had a serious lung infection, it's crucial to watch out for signs like shortness of breath, coughing, or chest discomfort. Don't wait, talk to your doctor if something doesn't feel right. This information might not eliminate the problem, but it gives you a better understanding of what to expect and, more importantly, what to look out for. Thank you for watching, and remember, your health is always worth the extra attention. If you found this video helpful, make sure to subscribe and share it with anyone who might need this information. We'll see you in the next video.